Good morning. So in viva, when you are taking an obstetric history, you start writing GPLA. G is for gravida, P for parity, L for living, and A for abortions. A lot of times students get confused between abortion and MTP. So in medical terms, whenever we say abortion, that means the patient wanted to continue the pregnancy and some unfortunate event has occurred because of which she was not able to continue the pregnancy. So when we talk abortion, it is mostly spontaneous in nature, and then abortion has a whole range. It can be from threatened abortion where there is some bleeding which has occurred, but per se on ultrasound baby is doing fine, where we have a watchful expectancy and we give some medications and we want and we wish to continue the pregnancy and pregnancy continues. So this pregnancy, this abortion, this bleeding is called as threatened abortion. In case the threatened abortion increases a little more, and there will be a time when in spite of doing everything we will not be able to help her and she will eventually abort. Now she has become from threatened abortion to inevitable abortion. Once the process of abortion starts, many a times half of the tissue or the fetal material is expelled and partially it is retained. So some products of conception are retained and some of it is expelled. This becomes an incomplete abortion, and in some women here we might have to clean it. Next step is when the whole of pregnancy is aborted or expelled, and this on ultrasound you will not see any part of products or anything inside the cavity. The cavity looks quite clean. Maybe the endometrial thickness is little more, but as such there is nothing remaining there, and that is called as a complete abortion. So whenever we talk about abortion, it is basically spontaneous in nature, and here the patient or the pregnant lady, she wanted to continue the pregnancy, but unfortunately something happened, and this is abortion. Now when we say the second part, the second leg of abortion is an MTP. MTP is medical termination of pregnancy. Here the woman deliberately doesn't want to continue the pregnancy under various, either she doesn't want to continue the pregnancy or the doctor feels that it is not safe for her to continue the pregnancy. So under various laws she can avail the services of medical termination of pregnancy. And currently Indian government through law allows medical termination of pregnancy till 24th week of pregnancy. So a lot of technicalities are there, but MTP is when, if I would have not intervened, the pregnancy would have continued right till term. Whereas spontaneous is that due to some unfortunate event, patient has kind of spontaneously started bleeding or the process of abortion has started. So I hope this little video clears this doubt that what is MTP and what is abortion and what are the varieties of abortion. Here in this, I have a plate where you can see the first one here. The pregnancy is okay, but the patient has some bleeding, all right, and this is threatened abortion. So patient, there will be some subchorionic bleed on ultrasound, but per se the baby is growing fine and is all right. Now this can progress to any of it, or the bleeding will stop and the baby will grow. The second one is incomplete abortion. Here, as we have discussed, some partial amount of products have kind of are retained in the uterus. So sometimes it requires cleaning or some medical medicines or something, so that all the tissue is removed and the uterus becomes clean. And in this thing, we cannot see any fetal part. Everything has come out. So here we just maybe give an antibiotic cover depending on case to case or something. But these are the phases of normal abortion which you should know of. There is another variety of abortion which is called as missed abortion. So here what happens that at some point the baby stops growing inside the uterus. So first ultrasound, if the woman has got a first ultrasound, it shows like 5 weeks or 6 weeks of live pregnancy. And in second ultrasound, it is seen that although by dates and by ultrasound the baby should have been 8 weeks or 9 weeks or 10 weeks, but unfortunately the baby has stopped growing beyond a certain week. So it can come as 6 weeks of missed abortion. So although woman should have been 8 weeks or 9 weeks, but the report shows a lag of 15 days, 20 days, whatever might be the case. So in such cases, a woman requires some intervention to clean the product of conception which is inside the uterus. And many times if you don't do an ultrasound, eventually patient will start getting some bleeding, spotting, pain. That is the time when ultrasound is done, that what is the reason, and we find out that it is due to missed abortion. Now, normally when we talk about abortion, it is whenever the woman has lost pregnancy before period of viability, it is called as abortion. Above period of viability, it is called as a preterm labor or IUFT or whatever. But the for MTP, the period of gestation is 24 weeks. For abortion, it is period of viability, which is normally considered 26, 28 weeks in India, depending on which city or what kind of facilities are available. Thank you.